Good, but good afternoon, everyone, and thank you very much for the invitation to speak today. So I'm really pleased that I have the opportunity to share a bit about the NHS Insites Programme. So what it is, what we're learning, and also where potentially there could be a collaboration even more so between charities and NHS organizations to more effectively support innovation. So the context, unfortunately, I'm sure you're all painfully aware of in the NHS. Currently, we face immense financial pressures, workforce strain, but nevertheless a rising demand. And innovation is definitely regarded as essential for this. But nevertheless, we often get stuck at piloting, but struggle to adopt at scale in the NHS. And even though there is no lack of ideas and also no lack of research coming to the NHS, but often, unfortunately, in NHS provider organizations at the moment, we lack protected capacity to test them, multi-site evidence, and also clarity on business cases and how we can really adopt as business as usual. So that's where the Insights program hopefully comes in, and that's why it was founded. It is exactly designed to sit in that gap between a promising innovation being developed and it being adopted as business as usual in the NHS. So if you want to move to the next slide.
So I'm struggling to move the slide on. Sorry. Having lots of problems today. There's gremlins, isn't there? Let's see if this works.
I'm still on the first slide.
Okay, yeah, sorry. Why is that not moving on? Let me I can do it like this. I'll move it like this and then try and share.
Yeah.
Okay.
Thank you. So NHS Insights is a national program. It's supported by NHS England and sits in the Research and Innovation Department. And it's been designed to bridge or to support adoption and scale of innovation across NHS organizations. So it's ultimately a network of NHS provider organizations with the aim to reduce duplication, which unfortunately currently there's plenty of between different foundation trusts, and to build shared capability and ultimately accelerate the uptake of innovations. So we're a peer network of 18 providers currently covering all of England. From rural to urban, we have a lot of acute care providers on the program, but also ambulance services, specialist children's hospital, and ICBs. So in total, we cover 35 million patients and employ 155,000 staff. And at its core, we're trying to move away from single-site pilots that struggle then to scale towards a model where multiple NHS organizations can learn together and hopefully ideally also adopt together to generate better evidence. And on the next slide, you'll see the organizations that are part of the group. So 18, as I said, currently, and it is really covering from East, Mid and South Essex, the organization where I'm based at, to Cambridge and Peterborough, Newcastle, Northumbria, Torbay and South Devon, and Alderhay Children's Hospital. So just a couple of the 18 organizations that are part of it. And a bit more about what we're doing in the program. So a lot of it is, of course, around testing innovations. That's on the next slide. Thank you. Is around testing innovations. So we are, for example, also across the 18 organizations creating an evaluation framework so that evidence generated in one trust hopefully is more easily translatable into another organization and more easily understood, so that hopefully an innovation can be adopted more quickly than currently is the case. And we're also tracking more innovations. So the 18 sites report back to us what they have in the pipeline, what's currently live, what are the themes, where potentially are gaps, where we need to more actively look for innovations. And our second goal is to strengthen organizational capability and infrastructure. So Insights comes with a bit of funding for the organizations, and unfortunately, it is really a hard battle at the moment in NHS provider organizations to ring fence any kind of funding for projects that are not immediate firefighting, and innovation teams really struggle to be funded at the moment, and we provide a bit of funding so that the organizations actually have the resources to even look at innovation properly and with the time that they require. And we're also supporting the sites in building up innovation fellowships. For example, we have innovation apprentices. We've developed bite-sized learning modules around innovation just to build up this overall knowledge that is really needed to move the projects from idea to actually being embedded. We're also very closely working with other programs like the National Innovation Accelerator and the Clinical Entrepreneur Program to build an innovation culture and talent pool. And we're currently also developing an innovation culture toolkit that is also supported by the execs of the organizations that we currently have on our program. And one of our big goals, and is more a midterm target, is to really find out what works when it comes to adopting innovations and build up some kind of national best practice for that. So we have a couple of work streams which are on the next slide in that field. So this is really partially around aligning the processes between the 18 sites, but also creating some more templates and tools that are hopefully accessible to anyone in innovation soon. So one of them is really improving innovation procurement, which is a struggle for every site. So how can we really move and contract things on an ongoing basis? And partially it is because not everyone is aware of what the best possible process for that is and how to navigate through that process. That's partially a challenge for early stage innovators, but it is also a challenge for non-procurement staff in the NHS. And we are developing a procurement playbook that should be published in the next couple of months. We are also developing a shared triage tool to make it, first of all, clearer in the organization. What are they actually assessing incoming innovations against? What are the criteria? And to make it understood and accepted across the across the organization, because we've seen it a couple of times that an idea is locally or in a certain department well appreciated and they are keen to take it forward, but it just doesn't sit high enough on the trust's overall agenda, and then resources can't be made available for it. So we've encouraged, and we're working with all 18 sites to develop a triage tool, which again, we hope to also make publicly available to innovators so that they also know what trust is actually looking for what, and what is the benchmark they need to achieve to have a high chance of success of working with that organization. We're also made really good way in sharing in developing a shared approach for evaluating innovations, because again, the evaluation usually informs very much the business case, which is an essential part of really embedding a project. And also hopefully with the aim that this makes it, as I said earlier, easier for evidence generated elsewhere to be accepted in an organization, because again, the evaluation method is more understood and accepted also at that site. And I also mentioned already the culture toolkit. Innovation culture is ultimately essential, even with the best processes. If there's no culture of accepting a certain element of risk and accepting also the risk of failure and giving people the permission to try out new things, then even the best processes won't help. So currently we're working together with the 18 sites to develop how can organizations find out where they're currently at, what their weaknesses are, and what are tools that are available to help them to embed a stronger innovation culture that hopefully then leads to better outcomes. And hopefully that also will be available in the next 6 months. That's the work stream that only started just recently. The others are more advanced. And then one work stream that we kicked off in the NHS Insites Programme, but which has now been picked up nationally, is the innovation passport. Again, the idea is to reduce duplication, because we hear a lot from innovators that every organization, they need to do the rounds for any NHS trust with largely similar questions, but not identical questions. And it's very unclear what trust asks for what and in what level of detail, even though there is probably only a limited need for it to be that locally different. So again, the 18 sites have come together to develop a bit of a standard information checklist, basically, that they usually expect from an innovator they want to engage with. And this has now developed into a national innovation passport work, which basically promises that one single check and one vetting should then be good enough for all the NHS organizations. And this is in development now nationally, so it's been picked up by the Department of Health, and the aim is to have that first version published at the end of the calendar year. And probably there will realistically always be a small need for local customization of these checklists, but hopefully there will be a very strong standard, national standard that should give a lot more clarity for innovators and everyone working in the field. So these are the work streams that we currently have in the pipeline. But first of all, of course, we want to track with the sites what they're actually doing, and hopefully also track that what we're doing as a collaborative speeds up things, lets us do more innovation, and we've compiled some initial data on the next slide. So this is from last year, so this is already a bit out of date. We're just working on our new impact report, which will be published in March, April, probably. But the sites, a figure that I'm particularly proud of, so the sites that have been in year 1 and year 2 of the Insights program, so in their second year of being in the program, they increased their innovation activity by 34%, which I hope is an early indicator that the processes have become a little bit slicker and they are more targeted in their approach. But also very crucially, we have 43 projects that have now been commissioned as business as usual, which of course we hope this number steadily increases over time, and another 155 projects in the pipeline. And as I said, the program also funds resources in the provider organizations. So 48 innovation roles are currently funded by the NHS Insites Programme. And I think that's really essential because the innovation adoption funding that is usually out there is more project-based, but that really doesn't allow much ongoing infrastructure resource in provider organizations. But in our opinion, that's really essential. First of all, to work with the organization on what are actually the priorities, what is the strategy, and be more driven from what are the problems in the organization, what do they want to solve, instead of being completely externally driven on we do those projects that we can get funding for. So I think that's a very valuable resource that we provide as a program. And on the next slide, just to give you a bit of a snapshot of the kind of projects that we've been supporting and that the sites are running. It really ranges through different topics. And these are, of course, only headlines around productivity, inequity, supporting the workforce, and of course, supporting patient experience and outcomes. I mean, any innovation these days need to tick all of these areas really to have a chance of success. So the headlines don't mean necessarily that much. I think all of these innovations here support all of these areas. But for example, a couple of our sites have now implemented autonomous AI skin cancer triage or automated routine telephone checklists done by an AI bot instead of a nurse, freeing up clinical time for other things. We worked with a couple of sites to implement an AI algorithm that predicts and prevents did not attend in outpatient clinic settings. And that has uncovered a whole range of health inequalities where really our scheduling, which at times is still very inflexible and not very personalized, almost made it impossible for people to attend their outpatient appointments. And I think this work has really helped that we can offer slots that work better for the people instead of just accepting DNAs and potentially discharging people back to the GP without having seen them. Also, rota management is very important for most organizations because that's usually a big source of disgruntlement for staff. So there are different solutions that we're trialing with the sites. And then also new ways of point of care diagnostics, for example, to identify what kind of stroke a person had already when they are seen by the ambulance crew, to identify whether they need to go to a specialist stroke center or whether they can go to the nearest hospital. And that, of course, saves very valuable time and gets them the right treatment a lot faster. And little simple things that just make the patient experience so much better, like, for example, VR tools that can be used to distract children whilst they have a certain kind of treatment, and to gamify the whole experience, that they are already prepared for the hospital visit and then get bonus points if they are in the operating theater or something, just to take the fear and the anxiety away for the children, but also, of course, for their family. So this is a very brief snapshot. And on the next slide, and that's, of course, largely why I'm here, because I had really good conversations with Jane and Sonia, and of course also with Vin from Rose Trees already, about how potentially we can work together. Because when I heard about the TAR network and Sonia and Jane introduced me to it, we're so much aligned with the problems that we have and what we want to address. And we come from a provider perspective, and we bring those voices and that force, and there's probably more we can do together to create more impactful change. And a couple of thoughts that I had potentially is, so this is an offer. I know that many of you support innovators already and novel projects and products. And if you're interested in that, every 4 weeks roughly, we host a session which is called Pitch Perfect. It's ultimately an introduction session where innovators can pitch to the 18 organizations and either pitch with a certain need that they want to go for external funding and they need an NHS partner, or they're early days and they just want some clinical feedback on what they are developing. And the sites overall are very happy to support. Of course, we can't support everything. It needs to fit into what the organization wants. But if you want to introduce any of the innovators you're connected to the 18 NHS organizations, then we're very happy to facilitate that. And one thing that we've trialed last year with the Rose Trees Trust, and Vin will talk a bit more about that, is to run joint funding calls. I think what the Insites Network can now offer is really more multi-provider collaborations. And we've really only seen that develop in the network probably over the last year only, because initially the processes for innovation adoption in one organization are so cumbersome that many sites shied a bit away from multi-provider collaborations because it felt even more difficult to achieve. And over the last year, though, we've seen more multi-provider collaborations pop up. So again, if you want to potentially run a funding call with us to see an innovation that you are keen to see, or just projects in an area that you are interested in and want to support, then I believe the Insites Network could offer that you get multiple providers jointly working on one of those projects to get evidence at a larger scale than only working with one individual trust. And Vin, do you want to talk a bit about the call that we did together?
Sure. Yes. Thanks, Jana. So, as Jana mentioned, here at Rose Trees, we've been working with the Insights team. So this has been about a year in the making. So we've had some discussions, and we launched a joint call last year. And these are small scale pilot projects. As Jana mentioned, they're multi-site collaborations to generate evidence that will help take a already piloted idea towards scalability. So this stemmed from our trustees wanting us to engage in some research that would have a shorter route to patient benefit. Most of the work that we fund takes years if it ever gets there. So the trustees wanted to explore opportunities that might have a shorter window to patient impact. So we had, I think, an initial chat with Tony Young, who's the National Clinical Lead for Innovation at NHS England, and then he put us in contact with Jan and the Insights team. So we drew up a relatively straightforward application form, and we put it out to the Insights team, the Insights Trust, and we asked them to put in applications that would be collaborative between different sites. We got a good response back, a lot of interest. I went on a Zoom call and there was a lot of interest amongst the team, and it was really a case about trying to fit the applications in through the deadline. We got a shortlist and we funded 3 of them, which I think have just started. So we're very early in the process. We are looking to repeat that again this year. So Jan and I have had a preliminary exchange of emails, and we will probably meet in the short-term future to discuss how we might run this again. But so far, we've been very happy with the sort of projects that have come through the scheme. So Jana mentioned there was a VR headset to help children prepare for clinical appointments. There was one on making customized splints, arm splints following a stroke, which also again was going to be had the potential to be rapidly scalable. So these are the sort of practical ideas that we were very keen to look at. So yeah, happy to answer any questions on those.
Yeah, thank you, Vin, and thanks again for working with the Insights. It was a call that generated a lot of interest, and it was really encouraging to see that so many multi-site bids came in, even though it wasn't completely mandatory, but almost all the submissions were actually multi-site collaborations. And that really, I don't think would have been possible 2 years ago or so. But now that the sites are working more closely together already via the peer network, I think this adoption at scale just seems more likely now. So I'm very, very curious about the outcomes of those projects. And as part of the application form, we tried to embed the learnings that we've had from the program so far. So we put a lot of the work up front. They needed to already nominate an exec sponsor. They needed to ensure that the various teams that are involved in adoption, like information governance, procurement, finance, are all aware of the project already, even at the bid stage, and in principle positive about it. And we also asked the sites already for some KPIs that they think they need to then commission this as business as usual, and what the commissioning route would be. So as Vin said, the aim of this call was really to speed up the process for something to actually get adopted, because it was a call around innovations that already have a certain level of evidence behind them, but still lack that element of real world evidence to be actually commissioned. And I think that's often the gap that we see of really getting it from the projects from a research phase to business as usual, this real life, real pathway, real people using it in actual clinical scenarios, that evidence that then moves it on to commissioning. And potentially other collaborations, but I would be very curious, of course, to hear everyone's thoughts, is around, in general, evidence and publications. We as a program have published a couple of papers this year, and we have more in the pipeline. Some of them are around, we had one paper around what are the determinants of successful innovation adoption. We have one further in the pipeline that is around the valley of death. So why do pilots just die or fizzle out and not get taken on board permanently? And we've also worked with the Health Foundation on a paper on how innovation teams in provider organizations, what is their remit, how are they staffed, how are they funded? And it's a very, very big range of how that currently works. And over time, hopefully, we'll be able to gather from the organizations what, at least in most scenarios, works best. And again, in any topic that's around innovation adoption, if you intend to publish something, we would be very keen to collaborate. But again, very curious to hear your... Yeah, thank you. I think that was my part. Would be very interested to hear what you think, how potentially we could collaborate, because again, there seems to be such a massive overlap in what we're trying to achieve.